Hi there. Before the new year, I just wanted to share with you one of the gifts that I gave to all three of my young adult kids this Christmas. And don't laugh, but it was actually vitamin D. And why did I give them vitamin D? Well, you'll understand if you listen to this video, but I gave it to them because I love them and I want to protect their overall health. Because vitamin D is not just a vitamin, it's also a hormone. It affects our bones, it affects our muscle strength. We need it for our immune system, and we need it to regulate inflammation as well. So I'm going to talk about 7 bad things that can happen when our levels of vitamin D are low. The first one, everybody knows vitamin D affects your bone health. How does that happen? Because when your levels of vitamin D are low, you have a reduced absorption of calcium from your gut. And that will lead to bone loss. You start losing calcium from your bone, which can also lead to osteopenia, osteoporosis, and an increase in fracture risk. So if you're taking calcium either through your diet or through supplementation, but your levels of vitamin D are low, it's practically useless. That's number 1. Number 2, we'll talk about something that many doctors don't associate, which is low levels of vitamin D with muscle weakness and chronic pain. When our levels of vitamin D are low, we develop thigh and hip muscle weakness. We also develop poor balance, and that increases our risk of falls as well. So if you combine the weak bones with the weak muscles, that's just a catastrophe waiting to happen. That's number 2. Number 3, the immune system. So our immune cells have vitamin D receptors for a reason. They cannot function without vitamin D. So when you have low levels of vitamin D, you are more prone to infections like the cold, flu, respiratory infections. And not only that, but your recovery is much slower too. And it goes deeper than that with the immune system. So people with low vitamin D levels are at a higher risk, and they have a higher severity of autoimmune diseases like rheumatoid arthritis, multiple sclerosis, inflammatory bowel disease. That was number 3. Number 4, cardiovascular disease and metabolic disease. Low levels of vitamin D lead to insulin resistance, which can develop, you can develop type 2 diabetes, and you are at increased risk of strokes and heart attack and elevated blood pressure as well. Not only that, but if you have that stubborn fat, that stubborn weight that you just can't seem to lose, and your levels are low, that could be one of the reasons, because low levels of vitamin D lead to make fat loss much harder. Next, we have brain fog and mental health. So vitamin D also affects depression and cognitive decline and brain fog. In the long term, you can develop Alzheimer's disease or dementia, because we need vitamin D to make neurotransmitters and to protect our neuronal cells, our neurons. Next, we have something that also goes misdiagnosed. One of the most common reasons for this unexplained fatigue or chronic fatigue are low levels of vitamin D. And doctors, again, sometimes fail diagnosing this in patients. And the last thing I wanted to talk about regarding vitamin D low levels is an increased risk of cancer. There are certain cancers, most notably the colorectal cancer, which is associated with a low level of vitamin D, but there are other cancers also linked to vitamin D deficiency, and these are breast cancer, prostate cancer, and multiple myeloma. So now hopefully you understand why I take vitamin D and why I gave vitamin D to all 3 of my kids, and they will continue to get that as a little Christmas gift every year that I am around. So it's easy to check your vitamin D level. It's just a blood test, 25 hydroxyvitamin D. You can ask your doctor to check it for you and try to stay in the optimal range so that you can prevent all these conditions. And lastly, Happy New Year.